Nick.
Bob.
Letitia. Lori.
Zach.
Sammy.
I would like all of you to imagine for a second that you have lived with horrible hip or knee pain, and that during surgery to have that resolved, they operated on the wrong hip or the wrong knee. Or imagine if maybe you only had one working ovary and went to surgery to have the non-working ovary removed, only to have the good one removed, and now your chances of ever having children are ruined. What if you had cancer of the lung or the kidney, and while having surgery to remove the wrong lung or kidney was removed instead? And then another scenario, maybe imagine if you were going to have an amputation of a leg or an arm, and the wrong leg or arm was amputated. Just imagine how you'd feel in any of these cases. Cases like this happen. There's cases out there all over with these kind of scenarios, and nobody wins in these instances. Horrible scenarios like these may sound far-fetched, but wrong site surgeries are real, and they happen in hospitals and surgical centers all over the world. They still happen despite efforts to prevent them. Now we must take another step to ensure, and another precaution to make sure that these kind of things do not happen and to protect our patients. How many of hospitals have taken many precautions to protect patients from these kind of scenarios, like having a patient mark the site of surgery before they go, consents that everybody needs to sign before the patient can go, anesthesia has to visit with the patient, the surgeon has to mark the patient before they go, and there's a timeout in the operating room that is performed before the patient is even put under anesthesia, and to make sure everybody is on the same page. But is this really enough? Because these wrong site surgeries still occur. Orthopedic surgeries are at especially high risk for wrong site surgery. The Pennsylvania Patient Safety Authority stated that the probability of a orthopedic surgeon doing a wrong side surgery is 25%, even with all the precautions that are in place to prevent it. So it would seem reasonable to me to take additional precautionary steps to ensure that patient safety is the highest priority and to keep people from having these horrible dilemmas. According to the Hillcrest Medical Center and Southcrest Medical Center policies on patient marking, there is a process that is supposed to ensue before the patient goes to surgery. This process includes the patient verification site on admission or during the preoperative preparation for surgery. There's a checklist that is to be done in the preoperative area by most facilities that ensures that all documentation is in the proper place and ready for the patient to go to surgery. There is also the surgeon that's supposed to come mark patients, most patients, as long as they're not exempt, and that there's a timeout prior to surgery with anesthesia and everybody in the operating room to ensure everybody's on the same page for the procedure. But there are those exemptions, and those exemptions for surgery, those that do not need to be marked, are considered like obvious single organ surgeries, like the heart, the colon, the thyroid, obvious wounds like burns or casted or splinted extremities. These, according to both of those facilities' hospital policies, do not need to be marked. They're considered obvious. But what if only one lobe of the thyroid needs to be removed, the right or the left? Would you not want that to be marked before you go to surgery? Or what if you have multiple burns on your body and you have bandages on some and maybe not some? And what if, can you assume that just the bandaged part needs to be, the surgical procedure is for that area? It would benefit both patients and hospitals to look at these policies and change them to state that that the surgeon must speak to every patient and that they be marked regardless of the type of procedure that they are having, and that there be no exemptions. The Joint Commission has done some research on the subject of wrong site surgery, and they have identified many problems and causes. One of those problems is identified in the scheduling area itself, where verbal requests are taken for bookings instead of written ones, or unapproved abbreviations are used, which cause confusion and dilemmas. In the preoperative and holding areas, there are things that are in place that primary documentation is not correct or inaccurate, like the H&P or the consent. There is also issues with inconsistency in marking practices on all facilities across the board that they did the research on, where their practices are a little bit different. In the operating room, they determined that the timeouts may not be as thorough, especially if a physician is doing multiple surgeries of the same type or is using the same team to do the operations throughout. They also determined that the marking may be removed during the preparation and the scrub, or that distractions and rushing can occur. They acknowledge that there is even sometimes a culture that does not take timeout seriously, or that people are passive and they do not speak up to prevent errors when they see that something might not quite be correct. With all of these already identified issues and problems, we should be taking extra precautions to prevent wrong site surgery, like maybe marking two identified sites on the patient, like if you're going to have your arm operated out, a bracelet and a marking. The surgeon should physically speak to and mark all patients, regardless of the type of operation that they are having, to prevent any of these errors from ensuing on the day of surgery that they're having it actually done. The Joint Commission Center for Transforming Healthcare offered some solutions to help improve the number of wrong site surgeries. One of their recommendations was that the surgeons must mark every single patient, regardless of the type of procedure. And these exemptions leave room for error. The Agency for Healthcare, but there are exemptions, and those exemptions leave room for error. The Agency for Healthcare Research and Quality revealed that communication issues are a leading factor in wrong site surgery. In the Patient Safety and Quality and Evidence-Based Handbook for Nurses, it is stated that hospitals will not be reimbursed for any costs associated with wrong site surgeries, and that timeouts can prevent the majority of wrong site surgeries. However, there are significant improvements in doing a briefing in pre-op area with surgeon and patient prior to going to surgery and prior to timeouts in the operating room. Orthopedic surgeon Dr. Brian Chalkin does about an average of 100 plus surgeries a week. He has never done a wrong site surgery, and when asked how he prevents this from happening, he stated, "I take the timeouts very seriously. We do not go any further with the surgery unless there is a marking and all paperwork matches the procedure that is being done." He stated also that the most important thing that he does that he thinks prevents this is that he visits every patient in the pre-op area on the day of surgery and marks them, speaking with them and having total communication with them on the procedure they're going to have for that day. So then why, if a patient who does this many surgeries and has been so successful with never having a wrong site surgery is doing so well with this, why would we not want to make this policy and put it into effect to prevent all of these surgeries from happening incorrectly in hospitals and surgical centers all over the country? If you were a patient, wouldn't you want that same type of care taken to have surgery if you were having to have it done? In conclusion, despite the policies out there that are put in place to prevent all of these things from happening and wrong site surgeries from occurring, it is our responsibility as healthcare providers to ensure the highest amount of safety for our patients and possibly preventing any errors from occurring. By taking extra precautions, with better communication between the surgeon and the patient, and better marking practices, we can best ensure that our patients and healthcare workers will not have to suffer for these or face the tragedies of these horrible wrong site surgeries. Thank you.